All right, thank you, Sam. Well, early detection and preventative measures are key when it comes to men and their health. Seeking treatment and advice from men's physicians can help them live a more healthy lifestyle and avoid any major health risks. Here to talk more about men's health is Dr. Keith O'Brien, Tallwood urologist, Fairfield region with Hartford Healthcare. Doctor, welcome.
Thank you for having me.
Thank you for being here. So how does health differ for men and women?
You know, for men, we're more likely to die of many other medical conditions that are chronic, like diabetes, high blood pressure, cholesterol, homicide, suicide. So there's definitely a difference. And, you know, men in general are less likely to see doctors for preventative things, ER visits. And so for most of us, admittedly, the hard truth is that if it's not broke, don't fix it. And often a urologist like me is often the first specialist they'll come to see to start a conversation about some of these health issues.
All right, doctor, what should men know about prostate health?
The prostate is an organ that's central to both your urinary and sexual health. For some reason, it grows in the middle part of life, and often it could be benign things that can lead to urinary problems for some men and can lead to some symptoms, such as weakened urinary stream, urinating more at nighttime. And often I think of myself as a plumber. You know, my job is to figure out a better way to improve quality of life for men as they get older. But there are other things that grow in the prostate too, like cancer that we see in middle and later parts of life, that there are some new and exciting screening things we can do for you as your urologist to try and evaluate if there's something serious going on.
Great to know. It's so common. All right, sexual hormonal health. We know a lot about that for women, maybe in menopause. How does that apply to men?
Yeah, it's the same idea. You know, women have OBGYNs to see. Men don't really have a men's health doctor, and that's where the urologist kind of serves a nice role as an entry point to start these discussions with men. I think the important thing for viewers to know is that an issue such as erectile dysfunction is not a normal part of aging. It could be a sign something's going on, like a warning indicator on your dashboard. And we've often found from research something like that could be an early indication of something like cardiovascular disease. And so it could entry into a point with us where we send you to a preventative cardiologist or someone to check out your heart. And so it's not just sexual function, reproductive function. There's a lot of things now we look at, like testosterone, in addition to erectile dysfunction, to try and figure out wellness for men. And this ties into this overall concept of not just one specific complaint, but taking a man's health in total and looking at different specialties to try and find out what could be the right thing for them.
Interesting. All right, the Tallwood Urology and Kidney Institute is dedicated to men's health. Tell us more about it and what can patients expect?
I think the Tallwood Institute has been very innovative in this regard with coming up with a multidisciplinary team under one roof that's almost like a one-stop shop for a man to come in and be checked out. It leads to a better level of care, better communication with providers, and we can direct you in the right direction, you know, depending on what we identify could be an issue. And it's safe, it's thorough what we do, it's evidence-based, it's not a pop-up clinic, it's something that we've studied and work hard at every day to make better in terms of an experience for patients that's holistic and incorporates some of the well-being regarding the urinary and the sexual domains that I talked about, and maybe even more, you know, regarding cardiovascular health and other issues that patients may have. I think a urologist is a great starting point for a lot of men in their middle ages, and I would encourage people to get checked out.
All right, Dr. Keith O'Brien, Tallwood urologist, Fairfield region, thank you so much. Great information.